Hello everyone, my name is Dr. Hartley Bowman. I'm a physical therapist here at Life Motion Physical Therapy. Today I want to talk to you about the pelvic floor and its role in incontinence. Have you ever found yourself leaking a little bit of urine whenever you laugh or sneeze or cough, or find yourself thinking, man, if I didn't get to the bathroom any sooner, I would have lost it? Those may seem like normal parts of aging or something that you find is normal after having a baby, but they actually are not something that you have to live with. Incontinence is actually a dysfunction of the pelvic floor muscles. Now, what are the pelvic floor muscles, you might be asking? The pelvic floor is a group of muscles that run from the front of your pubic bone to the back of your tailbone. While the pelvic floor has many roles, one of its main functions is to prevent you from going to the bathroom when you don't want to go to the bathroom, and then relaxing those muscles when you are ready to go to the bathroom. Two of the main things that we look for whenever someone is having incontinence is, one, is there an over-tightening of those muscles, meaning they just don't have the range of motion anymore to be able to properly do their job. The other thing that we look for is, two, is there a weakness of those pelvic floor muscles? Do they have that full range of motion, but they just don't have the strength to contract and perform their job properly, which is holding back that urine. Oftentimes though, these two dysfunctions can actually go hand in hand, and we see a lot of times people have weakness and tightness of the pelvic floor muscles. Today, I want to show you a couple tips just so you can start working not only on the mobility of your pelvic floor, but start working on how can I activate my pelvic floor if I am having those incontinence episodes. So join me now, sitting in a chair with your feet flat on the floor. We're going to do something called diaphragmatic breathing. What you do here is we're actually using our breath to relax the pelvic floor muscles. Don't think of this as bearing down, like if you were going to have a bowel movement, but instead think of it as you are using your air to relax those pelvic floor muscles in between those sits bones as you're sitting on this chair. So with me, what I want you to do is take a big deep breath in, and as you inhale, visualize that your pelvic floor muscles are relaxing down towards that chair. So what you should feel here is as you continue to do that deep breathing while I'm talking to you, those pelvic floor muscles are going to relax towards the chair. Your air is pressing them gently down towards the chair. And as you exhale, they're going to gently draw up and away from the chair. This deep breathing exercise is a little bit hard to get at first, but it is a great foundation for you to add into just any sort of daily mobility routine that you may be participating in, or add in during commercials on TV when you're not really doing anything else anyways. Having that full mobility through your pelvic floor is going to make the muscles have such an easier time contracting to support you whenever your bladder is full, if you are pregnant, to support you in holding up that baby, and just general daily activities. The other thing that I want to walk you through is how can you activate your pelvic floor if you do have leakage whenever you cough or sneeze or laugh. This technique is called the knack. So what I want you to do here is visualize that group of pelvic floor muscles in between those sits bones. As you sit on this chair, think of them like an elevator. You're going to draw them gently up into your body and then relax it. That's a pelvic floor contraction. Now what you're going to do if you do have some incontinence whenever you cough or sneeze or laugh, what I want you to do is when you sense that coming on, you're going to quickly contract your pelvic floor at about 30 to 40% effort and hold that just to give a little bit of support to your pelvic floor as you add that added pressure from the cough or sneeze or laugh. However, these techniques are not for everybody, and while you can try these, if you have any issues or questions regarding your pelvic floor or are uncertain about what type of dysfunction is going on, I would welcome you just to give us a call, schedule an appointment. We can chat about what's going on with you and figure out what is the best thing to help you get your life back in motion and not be limited by these problems. Thank you for your time.